Hi, my name is Preston, and my CAM therapy topic is reflexology. Reflexologists believe there are certain points on the feet and hands that correspond to the organs and glands in the body. Reflexologists believe by pressing and massaging these points, it can stimulate energy pathways throughout the body. Reflexology is a form of natural holistic therapy based on discovery that there are points on the feet and hands which correspond to organs, systems, and structures within the entire body. This corresponding relationship is called a reflex. A reflex is when a stimulation at one point brings about a response in another point. When using specific pressure techniques to stimulate the points on the feet and hands, imbalances in the tissues, organs, and body systems can be detected and effectively treated to restore balance and well-being. This is an image of a hand reflexology chart. It illustrates the pressure points in the hands and their associated tissues, organs, and joints. For example, the tip of the middle fingers correspond with the brain and head. The thumbs correspond to the pituitary gland, and pressure points on the palm of the hand are related to liver, kidney, and stomach. This is an image of the foot reflexology chart. Again, you can see how the heels correspond to the lower back and glutes, whereas the big toes pressure points correspond to the pituitary gland. In the next two slides, I'll discuss the history of reflexology. It is believed that reflexology was practiced as early as 2330 BC by the ancient Egyptian culture. This is evidenced by the famous pictograph found on the physician's tomb in Saqqara, Egypt. As trade and continents grew, reflexology spread and it made its way to Europe in 1582. In the early 1900s, reflexology came to the USA from Vienna, Austria by Dr. William Fitzgerald. He is acknowledged for his contributions to zone therapy. Dr. Fitzgerald discovered that the applications of pressure on zones not only relieved pain but helped determine the root cause. Eunice Ingram developed the modern mapping of the foot and hands for specific organs, glands, and other body parts, making the Ingram method of reflexology. The Ingram method of reflexology is the combined work and study of the late Eunice Ingram and her nephew Dwight Byers. Since 1942, reflexology training and practice have become more recognized in the healthcare community, benefiting all ages and stages of health and well-being. What to expect at reflexology sessions. A practitioner will conduct a thorough health diet and lifestyle consultation, which will involve current medications, recent operations, and illnesses. The practitioner will explain how reflexology works and then examine the feet and/or hands. The reflexologist will work both hands and/or feet during the course of a full treatment and may revisit certain areas to help balance particular reflexes. After a treatment, it is advised to drink plenty of fresh water to help flush toxins from the body. It's also recommended that you avoid alcohol and only eat light meals. A typical treatment will last 45 to 50 minutes, and 4 to 6 weekly treatments. It is generally recommended. Indicators for usage of reflexology. Reflexologists believe reflexology can improve the following: immunity, colds or bacteria infections, sinus issues, back pain, hormonal imbalances, digestion, arthritis pain, quality sleep, headaches, migraines, urinary tract conditions, nerve functions, elimination of toxins, depression, and anxiety. Contraindications: foot injuries, patients with foot fractures, unhealed wounds, or active gout in the foot should avoid reflexology. Pregnancy and early pregnancy, the feet reflexology sessions is altered by treating the uterine and ovarian reflex points gently or by avoiding them. Caution should be used during pregnancy because of reports that stimulation may cause contractions and blood clotting issues. Open wounds. In general, practitioners will stay away from open wounds and may choose to wear plastic gloves or not to treat areas that are compromised. Thrombosis or embolism. Clients who report current thrombosis or embolism should not receive reflexology therapy since reflexology improves circulation. It could potentially cause a clot move towards the heart or brain. Side effects. The side effects of reflexology are perspiration of hands or feet, sensation of being cold or chilled, feeling lightheaded, nausea, strong emotions, lethargy, loose, relaxed muscles and organs, thirst, contraction of muscle groups. Reflexology as a treatment or preventative strategy is used around the world. In the United Kingdom, reflexology is commonly used in the healthcare facilities as part of integrative healthcare services, particularly in cancer care and palliative care settings. In the Netherlands, reflexology is used to support patients undergoing medical treatments and to manage symptoms. In Singapore, reflexology is offered in hospitals and wellness centers as part of integrative healthcare services. It is often used for stress reduction and relaxation. Health teachings for reflexology. The American Reflexology Certification Board requires 110 hours in anatomy and physiology, understanding the body's systems, reflexology history, reflexology theory and practices, business and professional ethics. Additional requirements are 100 hours of hands-on work with a qualified supervisor, passing a written national exam, completion of a practical exam, and submission of 90 documentations of case studies. One study that was conducted on reflexology is the effect of foot reflexology on pain, comfort, and beta endorphin levels in patients with liver transplantation, a randomized controlled trial. Studies suggest that reflexology stimulates the release of endorphins, which is effective for controlling pain. The aim of this study was to determine the effect of foot reflexology on the levels of pain in patients who had a liver transplant. This study was conducted between October 2019 to April 2020 on patients in Turkey. 120 patients received either reflexology or routine care. Before the patients received foot reflexology, their pain, comfort, and endorphin levels were measured. Reflexology was applied for 30 minutes, and their pain, comfort, and endorphin levels were measured again. The patients in the control group were tested at the same intervals without any application other than routine care. Concluding the study, the experimental group showed a significant decrease in pain levels compared to the control group. The study also showed that the pain levels of the patients who received foot reflexology decreased more than those patients who did not receive reflexology. Additionally, endorphin and comfort levels increased. These findings concluded that reflexology could be more used as a non-pharmacological treatment option offered in post-operative nursing care. I'm from Syracuse, so I found a business that offers reflexology in my hometown. CNY Healing Arts Center specializes in reflexology services and offers both a 30 or 60-minute reflexology sessions. Their website is www.cryhealingarts.com. In conclusion, reflexology can improve individuals' physical and emotional health and overall well-being by using specific pressure techniques to improve imbalances in the tissues, organs, and body systems. Reflexology is an effective technique that is used to improve immunity, manage pain, improve nerve function, and decrease depression. Additionally, reflexology is is an alternative treatment option for individuals who do not want to involve the use of drugs to treat health issues.